We sought to look at real-world outcomes for DME with anti-VEGF. And the upshot is that patients in the real world being treated with anti-VEGF for DME aren't doing as well as they are in trials. And the reason for it is in part undertreatment and in part ocular and systemic comorbidities. And as we evolve from a volume-based fee-for-service healthcare system to a value-based system, physicians and the whole healthcare system are going to be accountable for their outcomes, will be rewarded or penalized based on those outcomes. So these real-world studies become more and more important as our healthcare system evolves. We found that on average, patients gain approximately 6 letters of vision at 1 year. And whether it was Avastin, Lucentis, or Eylea used as an anti-VEGF agent, the results were all very similar. The other issue that we looked at was who's at risk most for vision loss. And what we found is that patients who start off with good vision, 20/40 or better, actually lose 2 letters of vision at 1 year. So they actually do poorly. And it turns out that patients are slightly undertreated. Again, if we were to look at all of these large randomized clinical trials, patients get on average about 10 anti-VEGF injections in these trials, depending which trial you look at. And in the real world, retina specialists are administering approximately 8 injections on average in 1 year. So slight undertreatment. And then of course the other reason for underperformance in the real world is that these patients start off with other comorbidities, both ocular and systemic, that typically wouldn't be allowed in a randomized clinical trial. So for example,